Myself is Shalini Bharadwaj. Welcome to the ITV Network's Medically Speaking. So today we are going to talk about vaccine hesitancy. Now we have the guest with us, Dr. Girish Tyagi from Delhi Medical Council and Dr. J A Jayalal, who is the President of Indian Medical Association. Welcome to the Sir ITV Network's Medically Speaking. Sir, the biggest concern, as Dr. Harshvardhan, who is Union Health Minister, he himself has said that paradox is that countries across the globe are asking us for access to the vaccines, while a section of our own is, they are doing a misinformation and doubts for narrow political ends. The concern is, as Dr. Girish Tyagi, he himself has done yesterday a webinar with the doctors, that they are getting less doctors, less health workers. Dr. Girish, I know the reason behind it. Why less people are coming for the vaccination?
Because one of the issues that in Delhi there are two vaccines, of course, in India also, Covishield and Covaxin. Covishield is prepared by the Serum Institute of India and Covaxin is being prepared by the Biotech. Hello? Covaxin is being prepared by the Biotech. Now the Biotech, around 2 days back, Biotech has put on their website a fact sheet in which they are mentioning that who doesn't entitled to get a vaccine. In which all the list that if the person is having on the immunosuppressant drugs or he's suffering from the like cancer and all, they told that the person should not get vaccinated. So it is a confusion whether the central government of India is asking that these persons can get vaccinated, and in fact the manufacturer companies himself saying that they should not get. So there is a confusion, and there are patients when the doctors, because in Delhi and in other parts of the India also, primarily at this moment the healthcare workers are being vaccinated, and if the healthcare workers are not going 60% attendance or maybe 70% attendance, that means
So we have Dr. Jayalal also. Sir, what can be the reason behind it? Yesterday we spoke regarding the vaccination also. There are few centers where people are saying, especially junior resident doctors are also saying that they don't want co-vaccine. So what kind of problems you are facing?
Because in general, the safety, as for the safety concerns, proper safety measures has been taken in before declaring this Covaxin as a emergency for use. But regarding authenticity, it is at the moment it is not very clear whether it is authentic or not, because the trial are not taken as far as the authenticity or efficacy is concerned. So there's a scare among the healthcare, even in the healthcare workers, what to talk about the general public. So healthcare workers are, even the in the RML hospital or some of the hospital with the RDA recommend that they don't want a Covaxin injection, they can get the Covishield. But whatever the vaccine is available at a particular center, the person has to get only that vaccine. Of course, that is the law of the land also.
That means a trust factor is also there.
Yeah, but when Covaxin manufacture the Covaxin Biotech on the website, they are telling that these persons should not get vaccinated. That means, and Government of India is telling that these should get vaccinated. So there is a controversy between the two, Government of India and the Covaxin, and let the Government of India clear their stand, and then of course Biotech should take action accordingly.
So Dr. Jayalal, sir, we wanted to know what kind of problem IMA is facing. Why people are not coming for the vaccination? What kind of hesitancy they have?
I do not fully endorse the view there is a much hesitancy among the doctors. So it is a natural process. When the new drug is coming, then vaccination is coming. That understanding it and looking at the effect of it it's a natural process. So this is what we expected also. We never thought that there will be a rush like a cinema ticket to people to come. Now, if you say, when you talk about hesitancy, you must understand from the first day, second day, the evolution, every day it is increasing. The people who are coming to the lab and this increasing. There are various reasons, not only the hesitancy on the unbelief on the vaccine, but there is also then some of the doubts created on the procedure itself. First of all, it was put that only when you are registered and only you will get a message that you need to come on particular time and get the vaccination. People are waiting for that message to come. And that system has not worked out. Now we have opened the gate for the doctors to come with that Aadhaar card and get vaccinated. Now in many of the centers, yesterday in my medical college, there was 100 seats reserved, but 120 people have vaccinated. That is what is happening there. Yes, there are some issue with that Covaxin and the Covishield. But I always understand our modern medicine is an evidence-based medicine. It is an evolving medicine. What we say true today may not be the truth after the 10 days or the 10 years. So when that evidence has come, there is some people with the effect of the drugs, blood thinners when they take, then they have a problem with that blood clotting. And it is advisable for them to get a second opinion. That is quite natural for that. When we are giving a vaccine, this is not that all the answers, all the questions are not answered, but still with an answers given, with an evidence which is available, we are sure this is safe, and we are very, very statistically, we are believing that it is efficacious, and this is a good arm in our hands at this moment to protect us from the corona pandemic, vaccination. It is not only the particular person who gets the vaccine, get the immunity, but by getting that immunity, more than 60% people, then we will have the herd immunity. So that is what Indian Medical Association, now we are asking the people for the safety of you and the nation. It's a perspective of the national perspective that we need to get vaccinated. I am confident on that. This hesitancy will be definitely overcome, and definitely this will be settled. And in the few weeks, and in there, the 80 to 90% of the designated the COVID, the frontline workers will get vaccinated on that issue, because now it is almost a week since we have taken the vaccination, and the people are seeing us. People are seeing our leaders, those who are vaccinated. Still, we have no symptoms, nothing. We are very safe. So definitely, this is giving a good lesson for our people to go ahead. I am not seeing anything negatively on this side. I am only positively looking at this with progressively we will be able to overcome this.
Sir, what is the role of vaccination in eradicating a particular disease?
So today, one of the issues which we are facing is the polio. Now, polio is in my younger age group. I have seen a lot of people with the paralytic people with pain. Today, I am seeing hardly anyone paralytic. India was able to eradicate the polio from this country. India could eradicate smallpox, which is a vaccination. With the vaccination, we could eradicate things. But look back into polio. For every 2.7 million polio dose, there were 1 cases of flaccid paralysis due to the vaccine that has happened. This is inevitable. This is unacceptable whenever we say that. So with that vaccine, we could prove that we have now eradicated polio. We have eradicated smallpox. We see in olden days, before that BCG vaccination when come, there are a lot of people with the TB meningitis and the pulmonary, miliary tuberculosis dying in front of our own eyes. Today we see, yes, there are some people who still get tuberculosis, but that the effect on that is very much low. Their complication is low. So vaccine is one of the known entity in the hands of our people. The diphtheria we have eradicated. We have now almost reduced the tetanus incident. We have reduced this. And this is our success story. And what we need to have is not the 100%. It is only 60 to 70% of the people if we can immunize or get that vaccination. That is good enough for us to get the... So now, how long you are going to with a mask? How long you are going to live with this pandemic? And there are, even my own doctors, 730 people have died with this COVID. I cannot sit quiet and say that there is one complication, there is somebody is getting fever, so don't vaccinate. And I am thinking in a larger scale, even if there is a complication of 0.1%, 0.2%, in the over larger perspective of the nation, perspective of our country, that we need to propagate this vaccine to the maximum possible level.
Yes, you are right, sir. So, Dr. Girish, have you vaccinated yourself, sir?
Yeah, I myself got vaccinated in the trial itself.
And still smiling and smiling happily.
Yeah, yes. Yesterday I got the booster dose also.
Booster dose also. So, sir, you please share your experience, because people are confused. They are not completely aware. They are, we can say that, they don't want to come for the vaccination. What can be the reason behind it, and what kind of
No, the
problems you are
share is
facing?
there, but I'm not facing any problem. In fact, only the minor issues will be there, like that at the site of injection there can be pain, there can be redness. That these are the minor issues which of course settles on their own. Nothing medication, it's also not required. And wherever the centers are there for the vaccination, the proper care and proper, if some untoward or reaction occurs, there are measures being taken by the state government and the central government to see to it that the patient get a proper care, and for that matter.
Yeah, and of course, as you said that, the app, that is COVID app, we need to work on that also. Sir, we have with us Dr. Samiran Panda also, who is from ICMR, sir. Welcome to the ITV Networks, Medically Speaking. Sir, you are continuously awareing people. You have created a kind of awareness continuously. We can see you on televisions also. Sir, kind of problems, why people don't want to come for the vaccination? What is the reason behind it?
Well, this is an issue which is important and requires careful consideration. The disease is new. The humankind has come to know about this disease just for a year or so. And the vaccine which has been developed is also a scientific marvel, in the sense, after knowing the total genome sequence, it was just 10 to 11 months time, during which period the scientists came up with a vaccine, which is very different from what people were aware about. In the older days or earlier time of science, it would take 20 or 30 years to come up with a vaccine. And now we are talking about 10 to 11 months. So you see, what are the two major factors which are contributing to the hesitation? One, the disease is new. Of course, everybody wanted to have a vaccine, but when the vaccine came into being, then we are saying, could we not wait for some more time? You see, we were wanting to have a vaccine, but when the vaccine is there for us, we are saying, what was the hurry? Could we not wait for a little more time? Why? Because our earlier conceptualization or earlier understanding about vaccine development always says that it generally takes 20 or 30 years. So that's why we suddenly, get scared. Oh, is it going to be really safe? So I would say that this hesitation, which we are observing amongst the frontline workers, including healthcare workers, physicians, nurses, that's normal. But overcoming it is superlative. That is possible, that is doable, provided we discuss these issues or the concerns that the potential vaccine recipients have in their mind. So we need to probably repeatedly underline that this vaccine or these vaccines which have come into being, although they have come into place within a very short period of time from knowing about the total viral genome sequence, no safety corner has been cut. So it's absolutely safe. So if the certificate of safety can be emphasized upon, then I think it will really help people to understand that, okay, there is no worry about getting this vaccine introduced to my body or administered to me. So that's one. And secondly, I think that what we are seeing, I'm sure all of us here and the other, panelists who are here, interviewees, all of us are seeing that it's not just the right information which spreads due to the social media or the mobile phone that we have at hand. Also, the wrong information spreads pretty fast. So it's almost like an echo chamber. So you produce a sound and the echo reverberates. and it moves and it spreads. So those who are yet to make up their mind, if they get exposed to more wrong information, which is not grounded in scientific evidence, that will also increase the hesitancy. So I think it's our responsibility to address these issues rather than saying, oh, those who are not ready to take the vaccine, they're they're not courageous enough. It has got nothing to do with the courage. It has got to do with hesitation. Hesitation,
the confidence also.
Yes, absolutely. So the hesitation and lack of confidence coming from the paucity of information. So information needs to be given. An environment needs to be created where discussions can happen. So it's not about blaming anyone, but it's about listening to the issues and the concerns and addressing them. And the doctors who I was listening to, they can serve also role models, because if there's an example, as we call it, peer influence. So everybody at certain point in time in our life, we start listening to our parents. We listen more to our friends, because that time we would think friends are my best well-wishers, although that is not the case all the time, but friends are somebody we listen to. So if the physicians or the nurses or the other healthcare workers, they have received the vaccines and they can share their experience, which you are doing on the screen now, asking them, and those sharing of experiences could also help. So I would say 2 or 3 things. One, the information that needs to be given, the concerns which need to be listened to and need to be addressed from scientific evidence, and thirdly, the role model that the vaccine recipients could play, the role that they could play because they have received the vaccine, their own experiences, and the words of mouth then spread. So it is not just the social media based wrong information which spreads. We have to take initiative by which we facilitate the spread of right kind of information, the confidence, as you said.
That means, sir, people should not follow campaigns of mistruth. That is very important. Dr. Jayalal, how you are dealing with such issues? How you are felicitating such issues? That the people are confused and they don't want to come. Are you doing some kind of awareness campaigns related to this?
Yeah, that is now the people we are able to approach to the social media. Then the Indian Medical Association has a wide network of social media in all our handles, and we are spreading the message. And most of our Indian Medical Association, in association with the Ministry of Health, and we are now linking all our social media, our website to the Ministry of Health. So anybody who gets on that, and we are hashtagging with our Twitter messages. And all our leaders, whenever they are taking the vaccine, and that is being also projected to the society to show that they are not having any complication on that is. And we are also now bringing out scientific evidences on that and how the vaccine is helping, and what are the effects which is going to happen,
yes,
and why even even see, when I firmly believe only when there is an effect, there will be some side effect will be also there. And if there is no effect, no side effect will be there. So when the side effect is there, that shows that something is happening in the body, that is our purpose is serving, that reaction is really taking place. So this kind of information we are sharing with that, and we could build up the good media relationship also, like people like you are now taking up the views of Indian Medical Association through the various platforms, and we are able to communicate to the people. And I periodically now convene a meeting with our state leaders and branch leaders. And we have now we are making an arrangements with the centers where they are the immunization is taking. Each of our branches are fixing dates, 1 or 2 days, so that entire our doctors from a particular branch, there is 100 people, 200 people, they are ensuring. And main important thing what we are now telling our people, it is not only the doctors. When they go, they will not go alone. They will always go with their team. There is a hospital workers, the nurses, the other people will be also go. So these people are going as a team and taking up the vaccination. That facility is now being taking place. The administrative struggle which we had initially with the registration, other things are now resolved, Now there is much more with the freedom, people are going and participating. And third, we are setting up a monitoring system. So whenever there is somebody is getting any symptoms, any fever, and I know that right time when as Sarah has already said, addressing that, talking to that issue, and in their language, empathy language of understanding in their language, talking to is very important. So we are having a monitoring, which there most of these people who had small problems, then our local doctors are there, patting with them and explaining them the facts and understanding them in their local language. So that is giving us a lot of hope. Otherwise, by this time, if you see there is a 403 people had symptoms, it would have been flared up like anything. Now we were able to be there at the spots and help them at that their crucial time, be with them and helping them to understand the issue in the right sense. We are doing that. So we are in the front line, not only against the coronavirus, we are also now in the front line to propagate this vaccine, because we are 100% sure this is a great gift our scientists could give to us at the right moment, at the right way, so that we will be able to fearlessly go into the field and make sure India could overcome this corona pandemic in the days to come. So I was with the full gratitude to the scientists, full gratitude to the ICMR, full gratitude to the government of India, and we are actively involved in this as a social responsibility of every doctor on this.
So we have with us Dr. Girish Tyagi also from Delhi Medical Council, which plays very important role. Sir, what kind of message you would like to give to the people?
Yeah, a message to the general public. And yesterday we have our webinar in which around 200 doctors interacted. We have sent a message that they should go to their respective areas and told the people about that there is no side effect or less side effects. That these side effects are always even simple tablet of medicine can have a side effect. So Covaxin or Covishield or any vaccine can have a side effect, which they should go. They should people understand, aware the people about this, and this is the message. And of course, one thing is that when the person is registered with that on the app of the Delhi government, when he can go to the district at any center if there are less number of people, so that these manpower as well as the vaccine should be taken care of.
So, Dr. Samiran Panda, any message which you would like to share?
I would say that the time to get the vaccine is now, and embrace vaccine, not COVID-19. And COVID-19 vaccine prevents COVID-19. It does not give you infection. So come ahead, encourage others, embrace vaccine, but not COVID-19. Vaccine not only gives you direct benefit, but your families benefit due to your step to take vaccine, and the society at large also benefits, because the chain of transmission stops if sufficient number of us receive vaccines.
So
the time is now.
Please continue, sir.
The time is now. That's what I was saying. The time to take vaccine is now.
Yeah, that's very important. You know, it's Antim Prahar. You can say that, you know, time is now. Get yourself vaccinated. Thank you, all of you, so much for sharing your valuable experience, knowledge also. So it is very important for all of, you know, the frontline workers, health workers, you know, get yourself vaccinated, because it is, time is now, and it is a Antim Prahar. Thank you so much.
Thank you very much, Shalini, for thank you.
Thank you, sir. Thank you so much, sir. This is a recorded show, sir. I'm going to on air around 8 o'clock. I'll let you know.
Okay.
Thank
Okay.
Thank you, sir. Okay.